Hello, everyone. Thank you so much for joining us to another session of the DEMN lecture series, which I believe is the sixth session. In this session, we are going to have another relevant topic to disaster and emergency management. Today, we will explore the theoretical history of the child protection approaches in humanitarian action. In this session, Dr. Krueger will take us on a journey through the historical development of the child protection in humanitarian settings. We will explore how today's international frameworks were shaped by key moments, major actors, and evolving global priorities. But before going any further, I would like to start the session with a land acknowledgement. I am currently in my office on the Royal Roads University's campus, located on the traditional lands of the Lukwagan-speaking people, the Swangi and Esquimalt nations. I am pleased to introduce our lecturer today, Dr. Alexander Krueger, who brings over 25 years of the experience in child protection across humanitarian and development contexts. He has worked with organizations like UNICEF, Save the Children, the ICRC, and currently he teaches in the Child Protection and Wellbeing program at Royal Roads University. His expertise include alternative care, adoption, and the child welfare policy with a focus on reforming systems to reflect local realities and decolonizing global approaches to child protection. Thank you so much, Dr. Krueger, for accepting our invitation and for accepting to generously sharing your knowledge today with us.
Thank you. Thank you. I acknowledge as well, I'm residing here in the southern tip of Oak Bay, traditional land of Lukwagan and Sosepson people. And I'm new to Canada for the last 6 years. And yeah, it's a pleasure to be part of these discussions. And as you said, I'm part of the Child Protection and Wellbeing course in Royal Roads. I also teach public policy, but I have to say the child protection in humanitarian setting has been my focus for many years and still is one of my biggest passions.
Amazing. Thank you so much. I would also like to extend my gratitude to Mr. Sheriff MacArthur, who is a program associate at the Disaster and Emergency Management Program at the School of Humanitarian Studies, who accepted to help me with the technical aspects of these sessions. And he will make sure that the session goes smoothly and correctly until the end of the session. Thank you so much, Sheriff. And I would also, before inviting Dr. Krueger to start his presentation, I would also like to mention, like always, we try to keep at least 10 to 15 minutes at the end of the session for the exchange of the questions, for the Q&A. So please feel free to either write your question on the chat box, and we will make sure to ask your question and raise your question at the end of the session, or you may prefer to keep your question, raise your hand at the end of the session and ask your question yourself, and we will have a live session and discussion at the end of the session. And also before starting the presentation, as a reminder, this session is going to be the recording of this session is going to be available on the Disaster and Emergency Management webpage. And you will always have access to the recordings if you don't have a chance to listen to the entire presentation today. Thank you so much. And I stop here and invite Dr. Krueger to share the screen and start your presentation. Thank you. You're muted.
Here we go. We start well. Thank you very much, Mahmoud. I will start with just a moment. I have share. I have a problem that the caption is covering my option to share the screen.
If you change the size of the screen, maybe it helps.
The caption is still there. Let me see. Yes. Here we go. So the focus today is on the historical perspective on child protection in humanitarian setting. I will go through a series of slides, and I'll try to be brief and touch upon what are, in my view, the key turning points or the key moments in the development of the current status and practice and policies on international child protection. I will try to go as fast as possible to leave the time at the end for discussion. We'll go without hesitation. Therefore, we look at the importance of child protection in this presentation from World War II to these days, very superficially. We look at the emergence of some of the global humanitarian frameworks that are currently in place. We will consider what are the prominent international actors that have been influencing these developments. And then we'll conclude with some considerations on what is going on and what are the considerations that are needed at current status of affairs in terms of thinking and practice. As I said, we start from the World War II as a benchmark, mostly because it is on the wake of the Second World Conflict that big actions around children's protection have begun to shape up. So UNICEF was established in 1946, mostly to care for children who were orphaned and separated from their families, and it was mostly looking into immediate relief issues post-war. In 1949, a very important element of foundational element of the Geneva Convention for the International Humanitarian Law that really looks into the issue of orphan children and separated children from their families, and the mandate to reunify and reestablish family links for the Red Cross internationally. Similarly, in those years, UNHCR, so the High Commission for Refugees, was created, and we see that UNHCR has been very prominent in the first few decades of international child protection practice, and it still plays a substantial role, but other agencies have taken the lead in overall on child protection in humanitarian setting. Already from the beginning, there were NGOs that have been playing a role, and we see here a visual of the main entities already up to 1960, but mostly at the beginning, immediately after the war, there were already several NGOs which were active. You might recognize the most prominent one, like Save the Children, and which was actually founded in 1919 during World War I, but very active in World War II. International Rescue Committee was super engaged in resettling refugees in the US from the Nazi Europe, and since 1945 shifted to establishing operations in conflict areas around the world. And similarly, World Vision also emerged after the Second World War, and mostly emerged as a main actor during the Korean War. From the UN side, already in this period, as we have seen, UNICEF was created, and UNHCR and WHO, all agencies that have a direct responsibility on the care of children in situation of emergencies. At this stage, in the very early years of taking care of children in emergencies, the initiatives were really ad hoc and responding to acute needs and visible needs. So very responsive and not organized and not structured with programs. There has been large numbers of adoption during this big crisis, of course, during World War II, and a lot of displacement of children. But the Korean War brought a lot of attention to the adoption of children in situation of crisis. So this raised a lot of questions of safeguarding and the opportunity or the need to lift children from crisis situation. But that is a debate that continued for several years, still after the war in Korea. In these very early stages, as I mentioned, the practice on child protection or the caring for children in humanitarian setting have been mostly on reactive, and so means trying to reunify children with their families. What evolves in the 60s and 70s is a more international attention to international crisis, and we have international agencies that shift and begin to combine operations and focus on children in emergency, but also with crisis that becomes protracted. They look at merging some initiatives that looks more into development. By the late 60s, we have a lot of emerging attention to the family ties and the need to preserve family ties. And specific attention to child well-being that was not yet framed as child protection. In fact, it is only in the 70s, for example, that in the UK was created a professional statutory service for child protection. And in the same years in the US, for example, they were the first government-funded program and interventions to identify and protect children from maltreatment. So the concepts of child protection were just shaping up in Anglo-American setting, and certainly were still different in continental Europe. In international field, the organizations and the professionals involved have been influenced by the conflict in Biafra, in Nigeria, and the big case of the Operation Baby Lift from Vietnam War, where there were thousands of children that had been airlifted in 1975 for international adoption, that created a lot of contention and consideration whether that is the best way to deal with separated children or orphan children, especially considering that reflections on uprooting, the implications and the impact of uprooting children has on their long-term well-being were beginning to coming out. In the same years, the late 70s, I would say, we begin to see some very pivotal moments where the attention to children in crisis become much more structured, and we have some sort of child protection debates. I'm talking about the Cambodia refugee crisis. That is where, after the Khmer Rouge, large population were displaced in Thailand, and under the leadership of the UNHCR, there were large programs set up to begin dealing with the large number of unaccompanied separated children. And it was the first structured operation to deal with the identification of these children, their documentation, and then the effort to systematically trace their family relatives, whoever is still alive and traceable. This in contraposition to another viewpoint that was still strong at the time in the late 70s and early 80s of simply lifting children, and saying of saving children and uprooting them and bringing them to adoption to in safe countries and so on. So it is a pivotal moment, the Cambodia refugee crisis, because finally professionals involved with the UNHCR and NGOs involved. There was also Save the Children, there was also UNICEF involved. They started to create those programs for unaccompanied children. The implication, as I said, of uprooting children were emerging, and more studies were also becoming more considered, coming from the World War II, but also some research on child soldiers in the early 70s were beginning to highlight the implications, social emotional implications of children in emergencies that shed a light on possible solutions. This brings us to the 80s. So the 70s and late 70s were a rich ground and fertile ground for reflection and debate, and very different ideas coming together. But in the 80s, we see that in the Anglo-American context, or English-speaking affluent countries, for example, from a legislation perspective and a policy perspective on child protection, there was a lot of struggle and tension between the focus on the family preservation and the child safety. So the focus on the actual protection of children, not the individual children. And this is reflected also in the international level and in the perspective of international organizations, where in the 80s, clearly there is an emergence of more and more recognized need for the special protection of children in humanitarian situations. So we're talking about family unity, psychosocial care, and for protection from exploitation. So these are the three big themes that evolved in the 80s. Of course, at the end of the 1980s, a big step in the work with children has been the movement that brought to the approval of the CRC, the Children's Rights Convention, in 1989, where clearly protection becomes a legal imperative that is grounded on international law. So it's no longer an act of charity or an act of immediate emergency response, but it begins to be framed in the international law. And it's, of course, the CRC presents a broad spectrum of rights. Survival, development, protection, and participation are the core pillars. But in this case, it, for the humanitarian aspect, obligates government and caregivers to ensure that kids are protected from violence and exploitation, and introduces and formalizes the concept of the best interest of the child. And clearly that has a very profound ramification in the policy and practice of child protection internationally. Specifically, there is, in terms of international law, there was a reference on the government and entities refraining from recruitment of children under 15. In this period, in the late 80s, UNICEF identifies child protection as a more defined area of work, and they define a specific group of children that were not reached through the traditional and available set of services of education and health. So they started branding a new area of work, which were the children in especially difficult circumstances, and this developed in a rather thematic kind of programs. So they were focused on street children, focused on disabled children, child laborers, or exploited children, and those affected by war. That then became a more specific focus on those who are unaccompanied and separated, and those who were recruited and demobilized. At this time, at this time, still, there were, where are we? The 80s. Oh, sorry. Yeah. With this fertile ground, there were also some experience they have that had quite a lot of reverberation and influence on the following decade. We're talking about some of the pioneering programs from Save the Children in the Mozambique crisis, and where they began to develop what they at the time called social welfare programs for children, and focusing not only on their material needs of protection, shelter, and if you want, family reunification, but also began to elaborate the need for psychosocial support. And that, of course, opened the door to a massive recognition of the influence of the impact of what was called at the time the trauma of experiences in conflict and natural disaster, but also more nuancedly then presented as psychosocial difficulties and the need to cover a more comprehensive aspect of children's needs and children's requirements in difficult circumstances. There was out of the experience in Cambodia that I mentioned before, there has been a very influential study that came out in the 80s and at the end of the 80s, which was on the unaccompanied children in emergencies. It was a field guide, and that clearly created the foundations for some of the very large programs that were then used unfortunately had to be used in the 90s. And we see in the 80s and 70s and 80s a proliferation of agencies. If you see here, we have a series of UN agencies that slowly began to pick up responsibility and influence and build up programs or interventions around children and their protection in humanitarian situations. Then in red, you have all the NGOs that are now multiplying in terms of numbers. So you don't have only the historical NGOs, but more actors are coming up, like Terre des Hommes and ECPAT, because in the 80s and 90s, we have also the emergence of the awareness that a lot of the problems were also around the sexual exploitation of children and trafficking. And then we have the emergence of some of the other actors that have been very influential very recently, but they started to engage with the child protection issues in the humanitarian and development sector. Those are the two governmental agencies from the US. So those were the DECOF, the Displaced Children and Orphan Funds, and then from the US government, and then the PEPFAR that was focused on HIV and AIDS and did a lot of work in supporting children affected by the AIDS pandemic especially in sub-Saharan Africa. They've been super influential for a lot of the studies and the approaches that then they developed together with other organizations across the globe. And then we see that the two foundations, Oak Foundation, MacArthur Foundation, they started engaging in child protection in this time. And in the 90s, child protection began to be a program area for most of those agencies that I mentioned. So child protection gets a specific focus, specific fundings, and it is streamlined in the international humanitarian organizations. And although there, from a human resources perspective, there has been a lot of lack of clarity, or I would say a lot of variations of who would be a professional in this sector, also because these are areas that were developing at the same time also in most affluent countries. They generally, the majority of people enrolled in the early ages of those programs were people with a legal background, a lot of lawyers, and a lot of social workers mostly from organizations from the UK and North America, or later on also Australia, but dominated by English-speaking countries. So with a specific tradition of social work and understanding of child protection. We look at it later. In the 90s, as we see, there is also a further advancement of legal frameworks, very important for the continent of Africa, has been the codification of the African Charter on Rights and Welfare of Children, because it was going farther than on issues like child soldiers, and brought the prohibition of recruitment down to 15, as many African countries were already exposed to this challenge. The UNHCR also in 1994 came out with a very influential guide on how to deal with children in during a refugee crisis. So that covered all the specific protection rights for children from across all the experience of being refugees and then potentially resettlement. Unfortunately, the 90s have been the theater of particularly big and impactful conflicts. We're talking about the Balkans, but especially the Rwandan genocide, where there has been a substantial humanitarian response, but also a rather a very large commitment to deal with an unprecedented number of children. About 95,000 children were identified being unaccompanied and separated during the mass exodus towards other part of Rwanda or Congo. And in the experience of organization in this time was building on the Cambodia and the previous semi-structured way of working on separated children, but he got a lot of attention in this case. And so coordination became central, because there were several agencies involved in the effort to reunify children. It was not only the ICRC, but it was, of course, UNICEF, Save the Children, World Vision, and many others, and the IRC and so on. And the effort for reunification brought up a lot of new methodologies for identifying children, but also for tracing parents and so on. And that effort went on for several years after the initial crisis in 1994. So in 2000, I was personally even involved in programs trying to reunify, hard to reunify children. So they were considered leftovers of the mass reunification efforts. And so a lot of learning has been happening in those years. And similarly, there was an increased attention to conflict-affected children, thanks to the Grassa-Michael report in 1996, which was mandated by the Secretary General to have an understanding of what is the impact of conflicts on children. And that has been a pivotal moment in late 90s that brought all the agency to have a much more specific effort on children affected by armed conflict. Consequentially, in the 90s, there is the creation of the Special Representative for Children in Armed Conflict. We're still there and very active, actually. And child protection, as I said, becomes a distinct focus areas, but also within the child protection work, there is a much more distinction between the emergency work and the work that is done on development. And the approaches were beginning to be quite distinct. So child protection development was much more focused on legal frameworks, while child protection emergency still was mostly focused on unaccompanied children and children that are associated with the armed forces. What is of interest in the 90s in terms of key legal aspects or normative aspects is the launch of the Sphere project in humanitarian standards that didn't cover child protection, but has brought up a lot of the issues around accountability of international organizations working in humanitarian sector. This is relevant because in the early 2000s, we had the major scandals of UNHCR and Save the Children report revealing widespread sexual abuse and sexual exploitation of humanitarian workers and staff in West Africa. And so the consciousness and the understanding of accountability also to the population that is served, but within organization, was a bit of a wake-up call that put the seed also of trying to understand how much the action of these international organizations in favor, in support to children, have implication and consequences in the long term. Not only when there are abuses happening through the organizations, but also when organizations have facilitated adoptions or facilitated the movement of children without the necessary protection and safeguarding standards that later on have been developed. At this stage, we see there are more, there is UBS Optimus Foundation from Switzerland stepping in, and more NGOs developing in the 90s. We have War Child, Right to Play, really coming out on the verge of these large conflicts, and Friends International in the Cambodia crisis, post-war, and Family for Every Child. So evolution of NGOs and a more prominent also role of organizations like Catholic Relief Services and Caritas, who were already existing well before, but only in the 90s begin to deal with child protection. We come to the 2000, where there is a process of formalization and creation of standards for the organizations. So we go from a very ad hoc program at the very beginning to a process of formalizing things beyond the actual CRC, the Convention on the Right of the Children's Rights, and some of the Sphere project. Here we become much more specific on the area of protection of children in humanitarian setting. And in 2005, I think, there was the establishment of the MRM, the Monitoring and Reporting Mechanism. That is, the MRM is about reporting the most egregious violations of children's rights in conflict, and brings up the issue of a higher accountability of warring factions and governments in relation to child protection in conflict. There is also in the early 2000 the large reform of the humanitarian sector. So the promotion of the cluster approach, which consolidates those effort to coordinate programs and so on, and aimed at reducing redundancies, having more predictable programs for emergency responses, and creating more accountability for international agencies. Those efforts, of course, have had great impact and increased accountability, increased predictability, but of course didn't address or resolve all the problems that we still have in humanitarian action, especially in child protection. Under the hat of the cluster, there was a cluster was specific on protection, headed by UNHCR. And under that cluster, there was a subcluster that was specific on child protection, and UNICEF was heading that responsibility, which then with a specific also accountability on child protection as an area of responsibility, so having a coordination mandate in humanitarian situations. At the same time, the Global Child Protection Working Group was created, was an interagency group to try to coordinate and bring together understanding lessons and practices and try to bring together some standards for organizations or guidelines as UNHCR had done before. Among those, for example, there was a lot of prevention and preparedness emphasis, so a lot of consideration on making sure that all organizations abide to the same kind of approaches and understand issues like the importance of family ties or the problem of uprooting children. Having said that, we have two examples like the Indian Ocean tsunami. Across the area of program, all agencies have advocated and succeeded in suspending all adoption, both national and international, to avoid unnecessary adoptions and the lifting of children. However, later on in the Haiti earthquake crisis, in the confusion of the first few months, still several thousand, about 2,000 children were lifted and adopted abroad. And so this tells a lot about the still a lot of coordination and commitment by international organizations, but also the inability to enforce some of the standards that were taking shape. At this time, UNICEF promotes the protective environment, which looks at arguing that humanitarian development program should move beyond just looking at symptoms of child abuse after things happen, but work much more into preventative aspects and trying to work more on building communities capacities and state services capacities and so on. In 2012, in fact, the Global Child Protection Working Group comes out with the minimum standards on child protection, which were later updated in 2019, but they codified the best practices so far, focusing on agreeing on the principles of work and on all the major aspects of child protection. So that has been a great pillar, and is still a great pillar of the practice in child protection internationally. And it looks at case management, family tracing and reunification, psychosocial support, prevention of child recruitment, and coordination. Those standards have been promoted. There have been a lot of training, a lot of investment has been gone into that. There has been a lot of criticism on the way they've been developed and also on the way they have been implemented, but organization decided to implement those standards and then learn from the implementation and what works and what doesn't work. And we'll see what kind of challenges we still have. Just an update on the kind of organizations. We see that in the early 2000s, in the first decade, in the middle of the map here, we have interagency actions and organizations that are shaping up. So there is the Better Care Network that was born after with the same actors that were involved in Cambodia. There is the initiative Together for Girls, but there is also the CPC Learning Network that is like the Better Care Network oriented to learning and sharing lessons. And out of this, there is the Alliance for Child Protection and Humanitarian Action, that is the evolution of the Child Protection Working Group that brings together NGOs, UN agencies, and some of the government bilateral as observers, with influence from foundations supporting some of this work, and therefore also determining the agenda of these coordinating groups. And also we see the appearance of consulting firms that engage with the debate and the practice on the bottom right corner of the slide. Now, I am aware of time. practice, current practice and global initiatives, we had in in 2015 the Sustainable Development Goals. That is the first step where child protection is clearly identified and absorbed as part of the Sustainable Development Goal, on that wave, the Global Partnership to End Violence Against Children was created and was a promising engagement of multi-government and supported by UN and the Security Council, brought together some investing partners and some countries that tried to apply the INSPIRE framework that mostly is for development, but looking at system strengthening and legislation and norms change, and of course having some impact to the humanitarian frameworks. In 2018, we have the Global Compact on Refugees that was particularly important because looks at or advocate for investing in child protection systems also in refugee setting, and advocating that refugee children should be guaranteed protection through the child protection system of hosting countries. And this emphasized the learning so far that is still being discussed of how much even the humanitarian intervention in child protection should aim at building the capacity of local actors and local protection infrastructure. As I mentioned, in 2019, the CPMS, the child protection minimum standards were updated, and they are more nuanced and less, I would say, oriented at being blindly followed. So they offer some adaptation room. And there are a few initiatives that start to expand on the understanding of child protection beyond the specific individual child. So we're talking about safe education and schools and so on. So to summarize where we are now, there has been an evolution clearly in the thinking, the practice, and the policies of organizations that has, in terms of international organization, has become has converged more and more, and the demonstration of that convergence is the child protection minimum standards for child protection in humanitarian setting. And the focus is still pretty much on protecting children from abuse, neglect, and exploitation, despite the attempt to focus also on strengthening child protection systems or child and family welfare systems. There has been a clear understanding of the importance from being a neglected aspect of humanitarian action for child protection, or the recognizing specific children needs and protection necessities is now fairly established, although in some crises they're still not fully recognized. There is, of course, a continuous adaptation and innovation in the area of child protection internationally, and it does kind of reflect also the debates that happen in development, but also in our national legislations and discussions around the limitations of child protection systems and challenges that we face. There is clearly a shift towards looking at the resilience of children, but also of communities and families and national entities. A shift looking at localization. So localization means also contextualizations and making sure that local leadership is involved and is part of the decision and actively shapes the decision taken in humanitarian programs. But it is still, I mean, there is a great intention on that, but it's still a major challenge. So the balance between the global standards and contextual relevance is one of the big challenges that we see. I mean, it is great evolution that there is that awareness that there is this challenge, but is one of the major challenges still. And the voices of children have been constantly and progressively amplified, also of communities, but still we are facing challenges in making sure that children are part of programming. A lot is happening and is very good and effective, but it is not the norm to have substantive participation of children and communities in programming in child protection and emergencies. There is a move, of course, from a rescue attempt to empower models, but this we still have episodes of falling back into rescuing children and that very easy way of doing programming. This is the complexity of the map in the current scenarios that has evolved, as we know, in the last few months or years. The global partnership has folded and has been absorbed by specific areas of programming. Some foundations have withdrawn and are stopping the fundings on child protection, and PEPFAR and DCOF are now in turmoil, if not totally cancelled, during the recent changes in US government. But NGOs, international NGOs, are as many as ever. UN agencies have multiplied in terms of claiming a stake on child protection, and also there are more than these 4 companies working in the area and trying to influence the debate. What I would like to conclude with is really about the key challenges in the contemporary approaches. We looked at, despite all the learning and despite all the convergence and the great opportunity and advantages that coordination brings, there is a big disconnect between the coordination systems and the grassroots actors. The coordination and the big agencies tend to be dominated by one way of thinking, and emergency templates and models often override local practices. So due to emergency, due to the funding processes, programs need to hit the ground and run, and therefore there is not always the opportunity or the capacity to understand what is going on in a given society or in a given context. So models and programs are imposed from the outside. And then they disappear as soon as the funding finishes, leaving a lot of positive for some individuals, but a lot of the potential negative impact on children. There is a clear, still evident risk of sidelining indigenous knowledge and care structures that are not recognized and are not even promoted or built upon in time of crisis. The big challenge is still a proper and meaningful community and child participation in program. So the minimum standard do promote child participation, but as I mentioned, the challenges persist. There is still relatively limited agency given to children in program design, and the consultation with children or communities or local authorities is generally in humanitarian practice fairly tokenistic. So the programs are decided well before the crisis. So there are templates that are implemented, and for some aspects they is understandable, like for separated and accompanied children. That is work that generally international organizations are well versed to do, and they cover specific needs that require a substantive investment and know-how in terms of databases and communication and networking capacity and coordination that often in crisis situation they might be missing. But in terms of then support systems and family networks and community capacity to care for children, those should not be replaced or by external agencies or external approaches. There is a need, and that there is a lot of experimentation and trying to work on localized feedback for an increased accountability, of course, on at the local level. But we are in terms of work in international humanitarian effort for child protection, the conflicts are becoming more and more complex. There are issues that are not easy to deal with. If we talk about organization designated as terrorists and all the children that are involved in those systems. And there is a reduction, of course, of humanitarian space. And often we are still dealing with the weak state system that are overstretched for services and so on. And so there is a mismatch between the expectation of international organizations and coordination bodies and the realities that they face on the ground. This is the last content slide that I would like to see to present to you.
Maybe only in 1 or 2 minutes maximum.
Yeah.
Thank you.
The issue is there is basically that tendency to deploy global toolkits and global frameworks, but also minimum standards tend to feed a desire of compliance and is pretty much feeding one way of understanding child protection. And there is, in effect, a conceptual disconnect that has been raised since the 2010. So in the last 10, 15 years, there are conceptual discrepancies that have been raised, and the issue of questioning universalism, not necessarily of children's rights, but how the responses of child protection are really culturally responsive, and how much we are able to understand child protection through different frames, and probably promoting at this point child well-being rather than simply looking at the basic needs of physical protection and recognizing more of the socio-ecological framework around children and their culture and their meaningful ties, which would make the child protection.
Thank you, Alexander. So
yes.
we will make sure to, thank you so much. We will make sure to have enough time for the exchange of the question in the remaining time left for us.
I finished there, and just the last visual consideration, if you want. These are the organization, and on the left you have all the organization that are rooted or based or coming from Anglophone countries, so UK, US, and Canada, and Australia. In the middle, you have organizations that are placed in Europe, and but they are influenced largely by Anglo-American thinking on child protection. And then you have other agencies that are not in Europe necessarily, and they are in Switzerland or French way or French tradition. So that, in my view, tells you also why certain frameworks are dominant and why we're still struggling with decolonizing child protection. And I'm finished.
Perfect. Thank you so much, Alexander. I personally appreciate a lot your presentation, your lecture. For me, as a person who knows very little about the child protection and well-being, that was amazing. I couldn't expect more, as giving me a very historical perspective of how this field, the knowledge, and also the history in the child protection humanitarian action emerge and evolve over the time. So I personally appreciate it. I'm very thankful for your presentation. I enjoy listening to your presentation a lot. I'm pretty sure I have a couple of the questions, but I believe that that our audience will have also their question. So I will prioritize their question. Please feel free to raise your hand or maybe even ask your question, writing down your question in the chat box.
I think we have a question from Kathleen in the
Sure.
chat.
Yeah, sure. Yeah, we have a question from Kathleen, but maybe we can start from the Kathleen is our program head in the child protection and well-being. So maybe we can start from Kyle and then Kathleen, please. Yeah, Kyle, please go ahead and if you can please turn on your micro and ask your question. You're muted.
Here you
Thank you,
go.
Dr. Krueger, very much. It's a pleasure to meet you. My question actually retains more to like my background. As you can see my patch wall here, a lot of them I've worn. In those first 24 to 48 hours, how do we best protect children in that chaotic scene, specifically when we're talking about natural disasters, weather events, and search and rescue in a common meaningful approach?
Well, to be honest, generally speaking, in the first 24 hours, international humanitarian organizations are simply not there. So all the consideration apply very little. But to me is, well, there is the immediate physical protection. So the shelter and the ensuring that the people that take care of kids are safe and have the well-being of kids at their heart. But if they're not with any adult that is known to them, they should be immediately, supported for all their physical and needs, but also should be immediately identified and understand what they know of their family and so on, try to document those things. And making sure that they are in a safe place, while then different people might begin to look for their relatives and so on. Then it depends also on the age, of course. But I know of awful circumstances and so on, and the situation, for example, of the children in the Kabul airport during the evacuation, and those were a sort of a safe space, so-called child-friendly space, but mostly is a safe space created for children who were all of a sudden without the family, without an adult and so on. And they were kept there, fed and so on, but immediately also identified. So there are standard forms and so on that come useful to begin taking the information and not waste time, that offers you the opportunity to have a quick reunification and then for the good of everyone.
So just to summarize, what you're saying is to identify the child as quickly as possible will lead to a better outcome down the line.
Well, an increased opportunity or capacity to reunify the children with their families and understand how they've been separated and so on. And so if it is not the family, reunify them with their relevant community, and certainly avoid uplifting children from situations. If it is possible. Now, there are scenarios where Kabul airport teaches us, scenario where there have been decisions made at the last minute, and they've been airlifted to different countries. And some have been reunified, some have been just resettled. It's the same problem we had in Vietnam and in Korea. I mean, a lot of kids are adopted, and they shouldn't be adopted because their family is still there.
Awesome. Thank you very much for your time.
You're welcome.
Thank you so much, Kyle. Sorry, Kathleen. So I want to just make sure that our audience get the chance to ask their question first. But in the remaining time that we have, I will read Kathleen's question. Please elaborate it, Kathleen, if you want to to elaborate the question. But I will read it through your. Okay, yeah, here you are. Maybe you wanted to ask your question by yourself. Yeah, go ahead, Kathleen.
Thank you, Mahmoud. Maybe just given the audience, I might change my question. I'm going to leave the other question to Alex for another conversation that you and I can have. I am curious. Thank you very much for the history. It's a great time for me to hear that. I'm also curious because within disaster and emergency management, there is a focus on natural hazards. Within the within the context of safety for children and the not-for-profit organizations and intergovernmental organizations you talked about, it's a focus on children and making sure they're safe, whether or not it's a man-made or natural hazard. Can you talk about how you feel about putting these together or separating them out as the disaster field tends to do, as opposed to the child protection field, which tends to put them together?
Well, there are some considerations that are essential and basic and is about ensuring the survival, ensuring the physical protection of kids and so on. And that is a common ground for child protection emergency, whether it's a natural disaster or a conflict or development setting or a normal setting. But then there are specific situations and also different actors. So there are some of the tools and some of the approaches that are across scenarios, and I think they're relevant and they should be adopted and learned and maybe adapted to some circumstances. The really big difference in my experience is that the natural disaster is one event, and then there is already and impacts everyone, and then the whole community in theory, or those impacted, begin immediately the grieving and the recovery phase all at the same time. In a conflict and that is ongoing, the situation is much more difficult. So all the effort to ensure the kids are safe and so on might be influenced by your humanitarian access, by your issues of safety still in some areas, and the opportunity to reunify children if they are separated. But I don't think it's extremely useful always to distinguish those things, as I don't think it's very useful to distinguish child protection emergency and general child protection approaches.
Mm-hmm.
There are tools that are different, fine, or the speed of action, but certain things should be essential for everyone.
Very interesting question indeed, and I'm pretty sure that we can continue having this discussion on and on, continuing on. But yeah, maybe we can move on. So I'm cautious about the time. I know that the time is already up, but maybe Alexander, you can kindly stay with us.
I'm happy with another few minutes, no problem.
Amazing. Thank you so much. We have one more question from Asifa. So Asifa, please turn on your camera and ask your question, or to your mic, please. Yeah, go ahead.
Yeah, no, I just want to say thank you very much. That was very interesting. I don't come from this area. I'm a more general early childhood development person, or studying that area. But my question is sort of linked to your last point, and what Professor Kathleen asked about was more on the decolonizing and sort of looking at indigenous systems. And I'm thinking, when you've mapped out these organizations, it's phenomenal to see the movement. Is the place for networks. There's a lot of local networks that have been set up, and I'm more familiar with the African context. There's a lot of ECD, early childhood development action networks. There's work being done with frameworks like the nurturing care framework. And they don't deal with children in conflict, but I'm wondering, because they are such massive initiatives, there's a lot of work being done on measurement issues as well, whether there's an opportunity to link up with those sorts of organizations. And they are very large, and they are very, they're active, very active. So the whole idea of the networks, the African networks, and I'm thinking specifically from the African context, because that's what I'm familiar with, and where you may see them playing a part or influencing some of the more indigenous, because they are representatives from the various countries, the African countries, for example.
Indeed. I mean, I'm not familiar with the early childhood development networks. Thank you, Asifa, for this question. In my experience, the networks, and they started coming up also in child protection. I mean, there are networks in East Africa and West Africa, especially, and they're very strong, and they're regional. They tend to be regional, and also strong national NGOs. In my experience, I can speak to child protection. They also have been very active in supporting the drive that there has been within the child protection working group on saying, well, we need data. We need, as you say, measurement. I mean, how do we make sure that things are working? How do we know whether these approaches, these tools and so on bring the results? The goodwill of the organization is no longer enough. So they have been part of that effort. And However, there has been always a barrier, and I remember being part of the Child Protection Working Group and then a few meetings of the Alliance in Child Protection in absorbing and integrating the views of national organizations and local networks. But also because the communication goes two ways. If at the same time of the measurements, international organizations have been very busy in developing the child protection minimum standards, which tended to codify, in my view, a dominantly Western way of understanding intervention in humanitarian work. And with the creation of the standards, you create a framework that encourages compliance at the local level. And so those local networks and local organizations depend from the international organization for them funding. So if you want the funding, you want our support, you want to work with us, here is what you have to do. And the voice of dissent and the learning that there is in these networks still occasionally comes out, but it is a matter of where are there spaces of reflection and dissent, if you want, or creative discussion that are safe enough for local organization or local network. Those are not there. Are simply not there. And the creation of Inspire network, the Inspire framework with the global partnership to end violence against children has further reduced that space. There is really no debate that challenges that. It is more in the academia where we can easily talk about decolonization of child protection without risking much. But when you're in organizations, there are a lot of people that feel uncomfortable of how the work is done or those predetermined solutions that are imposed or used because they see that not always work. I mean, that they have some advantages and they produce some results, but in some cases are pretty problematic, but there is not that space. So I agree with you that there is enormous learning and potential at the local level, and the regional networks are also great. But what I see also is that regional networks are organizing themselves independently in Africa, which is great. Africa more than, and Latin America is a totally different discussion. They've been doing so for ages, also because international organizations have traditionally less engagement with Latin America on child protection, at least.
No, thank you. Thank you for that.
Thank you so much again. I would say that it's one of the, my most favorite lectures that I listened recently. That was very informative. Thank you so much, Alexander. I very much appreciate it. And I would say that, the recording of this session is going to be available on our website, and please feel free to reach out to the recording and introduce and refer your colleagues and your friends to the recording of this lecture and also our website. Thank you so much, and I'm going to end the session right now. Have a very good day.
Thank you.
Bye.
Bye-bye.